I'm Chad Setliff, President and CEO of Novant Health Forsyth Medical Center and Greater Winston-Salem Market Leader. I think it really goes back to the similarities between the military and healthcare. So when I was transitioning out of the military after being an active duty officer, I was looking for a profession that was noble, one that allowed me to continue the service that we had committed to at the Academy, a lifetime of service to the nation. And what better profession than one in which we can come in and serve those who come to us at some of the most vulnerable needs.
I'm General Jim Amos, retired United States Marine Corps. When I left the Marine Corps, I was already connected into what they call executive health at Bethesda, and they'd been caring for me for my last 15 years, my wife and I. So we were pretty confident that that's where we were going to get our health care from. And then the reality that it's a 7-hour drive and what happens if some emergency happens. So we elected to try to find a local health provider. And we looked all around, and quite honestly, we were headed towards another major firm here in Carolinas because our children got their health care from them. And it came to find out that that they weren't quite as veteran friendly as I had hoped they would be. Without getting into a lot of details, it became an expensive proposition. So I was a little bit frustrated over that after spending 42 years in the Marine Corps, and of course I'm a little bit older, so I was on Medicare and I had TRICARE for life for the military. I always believed that that would be enough, and it is for everybody else, but it wasn't for this healthcare system. And so through some of my connections in the Charlotte area, I asked around and I met who now the Chief of Staff of Novant, Kim Anderson, and Kim said, "Jim, you need to come to Novant." And in fact, I look back on that and I think, as much as I think of my time with military medicine, I'm really wowed by what I get with Novant. They've cared for us, they're very veteran friendly, not just because I'm a 4-star, but because they actually care for people and they care for veterans. They care for each one of their patients that way. So, you know, I like that. I like the fact that this is more than just how much money we're going to make and what's the P&L. This is actually about, do we have an obligation to the community that we live in? And the answer is unequivocally yes from my perspective. It's not just a matter of what else can I acquire and how big can I be on the balance sheet and how many employees can I grow with and what's this going to look like you know, at the end of the year. They're actually growing with a sense of responsibility to the communities they serve.
I'm Jameson Knight. I work in diversity and inclusion as a diversity and inclusion specialist. I served in the U.S. Army for over 5 years as a U.S. Cavalry Scout. I served in Afghanistan, only the time that I was overseas. Supplier diversity is also one of my larger roles that I have at Novant Health, making sure that we are also purchasing from diverse-owned vendors. So that includes ethnic minority, women, veterans, LGBT, and disability-owned organizations. After these service members return from deployment, if it's overseas or even if it's stateside, there's going to be some transition and coming back into the role that they're coming back into. Mine was a little different when I was overseas in the fact that I came back with a lot of buddies because I was on active duty and I stayed with those people. But what we don't see as much with the return service members who are part of Novant Health is they don't stay with that same group of people. They transition back into their roles within, can be just within a couple of weeks. So we're like, that has to be quite a transition. What can we provide them and what are the resources? Maybe not necessarily at Novant, why recreate the wheel if there's already an organization that's doing it? So that's where we've looked at partnerships outside of Novant. What does the VA offer? What does our Veteran Service Office here in Mecklenburg County offer? And what community partnerships such as the one we have here in Charlotte with Veterans Bridge Home.
Hi, my name is Marva White. I am Supervisor of Volunteer Services at Novant Health Forsyth Medical Center. Currently, I'm involved with working with the Volunteer Services Department. We also interface a lot with guest services. And just recently, we had a project that I was chairing, and it was the Veterans Project. And what the goal of that was to try to come up with some best practices for Novant Health to use in all of their facilities so that if you go to any facility, you would see the same services being offered to our veteran patients.
I'm Rae Workman. I'm a vascular surgeon with Novant Health, vascular specialist in Winston-Salem. I am also a colonel in the U.S. Army Reserves, and I am also a member of the Novant Health Veterans BRG. Yeah, my journey with the military started in med school, and I went to the military medical school and then was active duty for 14 years. And then got out and came to Winston-Salem, and eventually my group joined Novant Health, and we've been very happy. But there was a little part of me right here that was missing something. And so I had to talk to my partners, who were all very supportive about me deciding to go back into the reserves. And so now I've been back in the reserves for 5 years. It's great to work at an organization that allows me the freedom to do that.
Hi, my name is Ramsey. I'm an OBGYN with Novant Health Woman Care here in Winston-Salem, but I'm also a veteran. I was active duty in the United States Navy for 8 years. I did all of my OBGYN training in the military, as well as spending time caring for our service members. So some of the characteristics and attributes that I feel like I learned and really honed in the military and that I was able to bring to an organization like Novant Health were and are being resourceful, being able to utilize resources in your environment that you might not always think about using the first time out of the box. Being able to think outside the box, being able to be a team player, I think that's huge. That's what the military is built around. We work together for one mission, and that's very much one of the missions of Novant Health. I think that Novant Health provides a lot of support for team members, and that feeling of almost like you're part of the family. Very much reminiscent of my time in the military and having that family atmosphere. We all had one goal, and we all wanted to support each other in achieving that goal, and I feel like you have that here in our organization. We do take care of a fair number of service members' families that come here, and maybe their family's here, and this is where they're going to deliver. I do feel like I can connect with them in that way because I do very much understand what they're going through, and I understand the rules of the military, and I understand how their leave works and all of that, and I think it's helpful for them. I have gotten that feedback a lot before.
Hi, I'm Mary Monk. I work for Novant Health Forsyth Medical Center in administration, but my son, Sergeant Austin Monk, right here with my grandbaby, Knox, is at Fort Bragg, and he's been in the service for 4.5 years, and he works on the Apache helicopter in the cockpit, so he's in charge of electronics, avionics, and armament of the Apache helicopter. It makes me so proud, not only that my son serves, but that Novant is a huge part of just really being behind all veterans. Having Novant Health to support military families has been very eye-opening to me. Being new to having a child in the military, even though my father was in the military years ago, it's just been eye-opening in the fact that the support that we have is immense and great, and it's very much in the forefront. You always know about it being an employee, a team member of our organization. The support is incredible.
A great example, if you will, of how we support our veterans is with our new military leave policy, to be able to support those that are serving in the reserves that may be called to duty, and how do we support them during that time, but also help reintegrate them when they come back from a support and social standpoint, and economically as well.
You shouldn't get driven into indebtedness when you're out there trying to do the right thing with regards to serving our country. You want to, and the fact that Novant is going to make up the difference between the military pay and what they would have gotten if they'd have stayed back at Novant during that period of time of non-deployment, that's substantial. That's a testimony to Novant's care for their veterans. That's what they do.
We, as an organization, looked at our military leave policy, and comparing that to others in the industry, we realized that our policy had some work to do. Specifically, the biggest gap in our policy was that when our team members got deployed, they oftentimes would take a pay cut during their military service. And we recognized that that was a big disparity, as well as sort of a non-motivator for people to continue their military service. Our new military leave policy, which takes effect January 1 of next year, will provide for a salary differential makeup for our team members while they're deployed. We have always been a very military-friendly organization, but this really, I think, sets us apart as super military-friendly, particularly in North Carolina, which is one of the largest military states in the country. So also through the BRG, through our Deployed Team Member Action Committee, not only are we supporting team members while they're deployed, but we'll support their families who are left behind, because really every military member has a spouse or a family member who's left behind who is really also serving. So to reach out and support those people who are left at home, oftentimes alone, sometimes with small children, they have needs too, and so we are reaching out to those family members of our team members to make sure that they're supported by the organization while their loved one is gone.
What they're getting there is they're getting this broad spectrum of employees from every walk of life that make Novant this great family of physicians, nurses, healthcare providers, of the administrators, everybody that takes care of the communities. But the other side of it is hiring veterans and their spouses. What do veterans bring? Well, they bring a maturity that you're probably not necessarily going to get right out of a college graduate or maybe somebody that's a recent high school graduate. They spent 4 years at least learning about the willingness to work as a team, the importance of organization, the value of ethics and ethical decision making. And by the way, they're used to hard work. And so, and some of them have done it in not necessarily comfortable areas. This is not, you know, some of the places I've been in my last 4 years were not necessarily places you'd want to go vacation. And yet these young men and women have been out there doing it in 120-degree heat and very dangerous, and they've understood the value of sacrifice and hard work and diligence and stick-to-itiveness. And that's what you get in a veteran. So you hire a veteran, they've actually gone through all of that. And so you're getting something, not for nothing, your taxpayer dollars paid for, but you're getting that product. What you get with a spouse is somebody that has gone through not necessarily the same experience, but he or she's been on the periphery of it, and they've sacrificed. They've come to understand the importance of organization. They've come to understand the importance of living up to responsibilities, accountability, and all that stuff, because they've been raising a family perhaps while their spouse is deployed overseas. They've been having to do everything. So you hire a spouse, and you're going to get a twofer out of this thing from my perspective. You get a veteran and you get a spouse.
Some of the best practices that we came up with is that we would like for each facility to have a card. It's a veteran appreciation, a thank you card. We would like for each facility to have that available. Now, some of the cards are pre-printed, but we also have some agencies that will do a custom-made thank you card. We would like for them to present that to the veteran when they go in to visit them. We would also like them to just focus on rounding. And when we say rounding, that's spending quality time with that patient, that's a veteran, and just connecting with them and letting them know that as one of the service standards, we care. We also will have them to tell us a little bit about their military background. That volunteer that's going in there, they actually have a connection because they themselves have been a veteran. And so they go in, they make that connection. If the person is receptive, what they will do is that they will give them the card, but they'll also say, tell me about your experience as a veteran, and just let that person spend some quality time talking about that experience in hope that that's going to encourage that patient and it's going to provide a remarkable experience for them because somebody came in that cared, that had a common thread there. We know that these individuals have given so much to the country just to be able to, for us to go into that room and to say to them, thank you. We don't minimize what you did for the country, the protection that you provided. And so it's just that connection. It's just a natural conversation that we want them to have with that individual, and then for that individual to feel like someone stopped by my room today that I don't even know. I may never see them again, but we have a common thread. That's a veteran I was a veteran, and we had a conversation, and hopefully that's going to help that individual to feel better about being here at Novant Health and being a patient, and that's something that's going to stand out to them when they get home, that someone cared enough.
We really go above and beyond to thank them for their service and contributions to our country. I've had many patients comment on either the recognition or the engagement, or even just the lobby where we have Memorial Day wreaths positioned every May, or when we have our team members sign our flag, much like the one behind us, for Veterans Day each and every November. The business resource groups have really helped us with what I would call perspective. So as we engage our veterans and learn about their experiences, we're able to better serve our patients.
In the business resource groups, they're not necessarily made up of all veterans. A lot of times they're spouses of veterans, or they just have, they're allies. So it really is, it's an opportunity for people to, the business resource groups are an opportunity for people to get outside of the normal roles that they're part of and to be able to work within the company to really make a difference in the things that they value.
One of the things that the BRG has been working on is identifying our patients who are veterans. It's a voluntary disclosure when people are admitted to the hospital, but several of our facilities now are placing cards outside of our veteran patients' rooms that anybody can go by and write a note on thanking them for their service. So for them to get a card signed by people saying thank you for your service, which was 70 years ago, is really remarkable.
The reason that I joined the Veterans BRG was because I felt this desire to continue to serve in some way. The Veterans BRG does a lot of service projects throughout the year. One in particular, that earlier this year, we had an opportunity to partner up with one of our food vendor, which is Thompson Hospitality in Morrison, and to go feed the homeless. So we worked with, I think it was Urban Ministries, and fed over 100 homeless in the Charlotte area.
My background as an Army officer, I think, helped me in a number of ways. First and foremost, as a leader, the ability to understand that we have a mission while we exist. For Novant Health, it's to improve the health of our communities. 1 in 10 patients each and every day is a veteran within our system and in our hospitals. So really bringing that perspective from a veteran as well to help our team members understand what they may be thinking or feeling or going through emotionally is a great benefit, I think, that we can bring both as veterans but also as leaders to help our team members understand what, from an empathy standpoint. Some of our nurses are combat nurses from the Army. Some of them are physician assistants that have been recently deployed. And when they come back, they've told us that that ability to remain calm and focus on the mission under fire is not much different than being in an emergency room when a patient comes in an extreme circumstance or emergent circumstance, and you really have to focus in on managing that in a calm but predictable way. We've talked a lot about the outcomes and the forward-facing initiatives that are visible to our patients and our team members through policies or other recognition. But what I'd really like to do is thank all those that spend tremendous amount of hours and effort beyond their daily job to really make this a wonderful place for veterans to work, a wonderful place for us to serve together to support our veteran patients, but also just work together to support our community at large.
We're very honored to be able to receive the Liberty Award that was presented by the American Heroes for North Carolina. It's a tremendous honor, and it's great to see that Novant Health is getting recognized for the tremendous work that we're able to do. It's been a collaborative effort with all the veterans and military initiatives, and a lot of people have put a lot of hours into this. So we're very honored and appreciative of this award.
I want to say congratulations to Novant Health. Being the recipient of the Liberty Award is a big deal, and it's a big deal because it's veteran focused. The only way you get the Liberty Award is all the criteria, the 20 years of taking care of veterans and all the things that you do. And so to Carl and the entire team at Novant Health, I mean everybody, it doesn't matter where you are in the system. Thank you for taking care of veterans. Thank you and congratulations on the receipt of the Liberty Award. And from all us veterans out there, all 225,000 of them in this area here, congratulations to Novant. We're proud of you. Thanks a lot.